This is Kim and Kim, and welcome to Ask Moms podcast.
Hi, this is Kim and Kim. Welcome to Ask Moms podcast. We are not professionals by any means, but we can share our experience and remind you that you're awesome. So if you feel you need professional support, please reach out to a qualified medical expert. Today, we are talking all things motherhood, the good, the tough, and everything in between. Our episode is about moms and children's common health concerns. Even though they don't feel common at the time, we understand the anxiety and the stress. We are so excited to introduce you to a very special guest, Dr. Tina.
Yay.
Dr. Tina is a well-respected medical doctor and also a mom of 3.
Yep.
So in our episode today, Dr. Tina has gracefully agreed to share some of the most common concerns mothers have and offer some helpful tips to hopefully lower your stress and offer a little perspective. Please note, because circumstances can be different for everyone, seek medical attention if you're not sure.
Absolutely. So, welcome, Dr. Tina.
Thanks for having me.
And thank you for joining us. So, we're very excited to have you here today because we know that you're going to offer so much comfort, clarity, and guidance to both new mothers and primary caregivers. So, Doctor, one of the main focuses we have in our podcast is to reach out to mothers, partners, kids, well, anyone really.
Everybody.
What are you doing?
Sorry. My button came undone.
Her button came undone. To let them know they're not alone and offer as much comfort as we can. So kind of like a virtual mom hug.
Totally.
Right?
Absolutely. Yes.
That's what we try to do.
Yeah.
So to everyone out there listening, if there's more than just our moms.
Both of you listening.
And Matthew.
Yeah, Matthew, yes.
Because this is such a vast topic, we could probably speak for weeks. 4 episodes in, I'm sure you know by now that Kim and I can speak for weeks on most topics. But anyway, because it's so vast, we thought that a good place to start would be with the most common concerns Dr. Tina hears from new moms, primary caregivers, and or kids.
Mm-hmm. But friends, some of you may be a little bit sensitive to some bits and pieces we will be discussing, so listener discretion is advised. Okay, now that that's all been said, let's get to it. Dr. Tina, during our chat last week, you mentioned something about the stigma of new moms and not breastfeeding. What are your thoughts on that?
Well, Kim, I think we've swung so far the other way towards everyone wanting to breastfeed. And for something that's so natural, it can be so difficult. And what I tell a lot of my patients is that it really is, it's a matter of a good fit between babe and mom. So sometimes there are struggles up front that are just not able to be overcome, which causes a lot of distress to women. They struggle with wanting to breastfeed so badly, and yet the baby is losing weight, and they're getting stuck in this vicious cycle where the baby is keeping them up because it's not feeding well, and then they're getting more and more tired, and less milk is being produced.
Yeah.
So I think there's a lot of pressure on you moms to feel that, what's wrong with me? Am I inadequate? Why can't I breastfeed? And yet, it is a situation that sometimes just doesn't work. And I think we need to remove that stigma from those moms because they put so much pressure on themselves to be these perfect moms that can do everything, right?
Mm-hmm.
And
It's so true.
Yeah.
Yeah, I hope that's helpful out there.
Oh my gosh,
That's
so much guilt. You feel so bad. You beat yourself up, and then you get more stressed, and then you can't produce anything, and everybody's anxious.
And you watch others around you that are doing it, and you feel...
What's wrong with me? I'm inadequate.
So there's nothing wrong with them.
Yeah.
And it's okay to say I've tried and I've given it a try and it's not working. It's also okay to just say I don't think that's going to be for me. And I think that's the other thing is that many women will be in a hospital setting or with their midwives and initially will be going along with the breastfeeding, but maybe they feel deep down it's not for them, but they feel that they have to look like they're trying because there's that expectation now. Everyone's going to think, what's wrong with me? Why am I not choosing? Because,
Don't I love my baby if I'm not doing this?
Exactly.
Yeah.
And now, we know that the World Health Organization supports breast is best, but there are situations where you can't And I think that we're okay to go with formula if that's the situation. Yeah. And also there's so many resources out there for women nowadays that, don't feel that you're inadequate if you have to, turn to somebody and say, help me through this, right?
Oh, nice.
Absolutely. No judging.
Yeah.
Exactly. I think we're too hard on each other.
Yeah. That's so enlightening. So, yeah, because most women are always under the impression that breastfeeding is the only option, right, to offer the best nutrition for the baby. So imagine some of those poor women.
Oh, yeah.
They're just torturing themselves if it's not working. And
Yeah.
so, yeah. So thank you for clearing that up.
Exactly. It's supposed to be a most beautiful time. And
Yeah.
if it's all stressed and anxious, that's no good
Yeah.
for you or the baby.
So speaking of what moms go through, is there information or are there any helpful hints you can share with us, Dr. Tina, that have just given birth or about to give birth? Things like pain management options and then after the baby is born, how long does a new mom typically bleed after giving birth and those types of things?
Oh, yeah.
Is there something you can give them heads up on?
Yeah, and what kind of pain meds you can take afterwards. After you've given birth.
So I think one thing that I want to point out to moms to be is that the more that you become informed about the actual delivery process and what to expect afterwards, it actually helps reduce the pain during the labor process. So being informed, knowing that this is normal, this stage of labor that I'm in, what to anticipate, I think not being informed leads to increased fear and leads to increased pain. And that's what the studies have said. They've also said that, having good support people around you really makes a difference in your pain level during the process. And I think that, going into it, knowing that everyone's experience is different, every delivery is different, and you might have a birth plan that just goes out the window, and just to be receptive to your provider's guidance and feeling confident that they're there to ensure your baby's safe delivery into the world.
Thank you.
Right?
Yeah.
And I think with respect to pain management, there are many options. Different medications that can be used, but even we know that laboring in the tub, being immersed in water tends to help reduce our pain. Counter pressure on our back if we're having a lot of back pain during our labor process. Certain positions we can be sitting in to lessen pressure on the pelvis. There's so many things that are besides medications that are there that help people reduce pain and make it more comfortable for them.
So being informed and knowing what to expect
would be very helpful.
Yeah.
And there are our health units have prenatal classes free of charge for both moms to be and their support people to attend. So there's lots of resources out there.
Nice.
That's so good to know. Thank you.
Yeah. And then at the end of it all, you get this beautiful baby.
That's right.
Yeah. So
for those stitches, if you have stitches, how long are they typically in for, and how do you take care of them?
So I would have to tell everybody that for first-time moms, 75% of the time we have some tearing action down there. So suturing, it just helps turn off that bleeding and help the parts sort of get reapproximated. So we use suture material that dissolves. No one has to go in there and remove those stitches. They typically will break down over time. For most people, about 7 to 10 days. And all you have to do is really just keep the area clean and dry if you can. With respect to the bleeding, so after we have a baby, we often have bleeding. That's very common for us to also have these afterbirth pains where the uterus muscle is trying to contract. And with that contracting down, there is usually cramping and some blood flow. The bleeding will taper off in the first few days, and then you'll be left with a discharge that can go on for 6 weeks after you've had a baby.
Wow.
So initially it's bloody colored,
Okay.
and then it'll go pink. And then it'll be a whitish discharge at the end of the 6 weeks. So it's all very normal to expect. And the other thing is a lot of first-time moms I think they think they're going to leave the hospital, or shortly after arriving home, they're going to be able to wear their pre-pregnancy clothes again. It's the rare mom that can do that. So most people are still wearing their prenatal clothing for a few weeks. So if you're doing that, this is the norm. So just to let people know that as well.
Thank you.
Yes, because that came up in our previous podcast.
That's right. I said I wore my maternity jeans for months and months after.
And that's something we don't share with other new moms.
But we should.
Yes.
It's totally okay.
Yes.
Yeah.
Actually, that's really good that you told about the discharge, because that's not something that's something that would be really scary. So thank you. That's pretty cool.
Yeah, for sure that would.
So for the moms that are feeling exhausted and have low energy, what might boost their energy levels? And maybe what are some signs of postpartum?
So I think
Good
this
question.
is, again, this feeds back to that, I can do everything.
Yeah.
And I think self-care is so important in that
Yeah.
postpartum period, right? And having people around us that support us. So when the baby's sleeping, we can sleep as well. And not having, to feel that, I've got to keep up with everything that I did before.
Yeah.
So I think, affording that opportunity to have some time by yourself. And I think as far as postpartum, I think most women will go through the blues. It's very common for us to see on day 3 postpartum. Many women will be very weepy or very emotional.
Okay.
And I think it's a culmination of just what's happening hormonally in their bodies, but also the lack of sleep that starts in that initial period postpartum that sets them up for the blues. But most women will start to feel better after that initial period of time. But you're right, as far as postpartum, it's a high frequency of postpartum depression. It's good to have our care givers and our partners be aware of the signs of postpartum depression. So a woman who's not quite herself as far as not really interacting with the baby, preferring to sleep most of the time, maybe being more withdrawn than usual, definitely, is somebody that we'd want to sound the alarm to a provider and healthcare provider and just say, I'm a bit concerned about how this person's doing.
And to know, too, that it's common, right?
Oh, absolutely.
And it can be managed. So, the most important thing I would think is to just, connect with your doctor if you feel that's you, right?
Absolutely. And I think one of the things is that I think that we're moving forward in the right direction. There's less stigma attached to feeling that not everybody is, over the moon happy after they've had a delivery process. And I think it's okay for us to come out and say, this is the way I'm feeling. And there are much more awareness of the frequency of this happening. And not just only for the moms, I have to say, also the dads can also go through a postpartum depression in that initial period as well.
I could see that.
So it's a big change to one's life, right? To have this responsibility 24/7 and have somebody you have to take care of, as well as
So
maybe
there's
put
gonna
your needs second.
Right. So there's going to be a few highs and lows before it becomes your normal
Absolutely.
daily family.
Yeah, exactly.
I remember when, my son's adopted, but I remember when we first got him, I knew nothing. And that I was always a person that had to have sleep. And that was my biggest drawback. Actually, I remember you were talking the other episode about looking in the mirror and going, oh my God, right? Well, I did the same thing at one point. I looked in the mirror and I'm sure, I'm not exaggerating, I look like 5 years older.
Wow.
Yeah. Who is this?
Taking
I
its
was
toll.
like, who the heck is this person, right?
Yeah.
So, and that was just through adoption, all the stress of not knowing what I was doing, just like any other mother, except now you also had gone through the actual physical birth. So my heart goes out to you, and I hope that this helps you because it's already helping me just understanding.
Absolutely. And don't be down on yourself, because if you're not feeling your normal self or what you are hoping you should feel like, acknowledge that and address that,
Yeah.
because you're worth it.
Yes, you
Moms.
are.
Yeah.
Yes, you are.
Another question, when is it safe to have sex again?
So that's an individual choice, I have to say. So I'm always surprised by how many women will come for their postpartum check. So typically around the 6-week mark, most healthcare providers will provide a postpartum check just to see that everything has healed up as we would expect postpartum. And a lot of women will feel that they have to get the A-OK to proceed with sexual intercourse again. But you don't have to wait the full 6 weeks. It depends on how you feel.
Yeah.
And again,
so it can't hurt them.
But I have to say, many parents of newborns will tell you they just don't have the energy.
Yeah,
when they rank sleep versus sex,
Yeah.
sleep tends to win over sex. So
Forgot about that, eh? It's like,
yeah.
who even wants to talk about that?
Who's feeling romantic right now?
Yeah, exactly. So
God.
just to let you know that there is no magic period of time that has to elapse. It depends on the individual and what's happening in that couple.
And how much support you have at home, how much
Exactly.
rest you
Yeah.
do get.
Right.
Yeah,
Maybe you're lucky and you do have somebody who's
But you
letting you have naps.
but you can't hurt anything.
No, you won't hurt
It
anything.
won't hurt anything.
No.
I have a question so we did write down some questions to be open, but I just thought of one I've heard of friends of mine that had new babies, and they get pregnant right away.
Yes.
Oh, good question.
So, yeah. So is that,
It's not birth control.
So if we're
What's-
talking about breastfeeding, I assume that's what the question is, or just in general?
No. Just for instance, my brother was born, and then not too long after my mom was pregnant with me.
So I think
So is your body still?
you can still ovulate even though you don't think you are.
Yeah.
And that's so most breastfed babies, most moms will not have a period for a period of time.
Okay.
Often it depends on if the baby is receiving food sources outside of the breast milk, so often with the introduction of solids. But even prior to that, we could see that ovulation is going to happen. So the hormone that helps us make our milk supply does prevent our periods from happening, but it can reach a level where you will ovulate. And if you're not taking precautions, because many people think that they have the myth that they can't get pregnant while they're breastfeeding,
Yeah, that's what I was asking.
they will get pregnant. So it is, if you have to sort of plan.
Yeah.
The other thing that, postpartum, things are a little bit different down below. Breastfeeding moms, that hormone that we talked about, the prolactin that makes our milk, actually makes us quite dry with a lack of lubrication down below. So when we do resume intercourse, it's really important that we use a water base like a KY jelly just as a lubricant so that we have a better experience when we start having intercourse again. And also, just to bring up that if you're motivated with your partner, condoms are absolutely fine to also provide protection. And then there's spermicide film that can be used as a backup if we have a
I'm glad I asked
micro
that
tear
question.
in the condom. Yeah.
Totally.
So I think people forget because, having intercourse while you're pregnant, you totally lapse that you even have to think about protection and then you could get caught.
Yeah.
Ooh,
and you'd have two babies in diapers.
Oh my gosh.
Yes. Yeah. And it happens. We see it.
I know.
So on that same kind of gist, how long can you keep having sex before you give birth?
Oh, good question.
As long
Same.
as you want. So what
Okay.
we usually tell moms is that intercourse is different when you're pregnant. So you often have more lubrication than what you used to have pre-pregnancy.
Okay.
And also just to factor in that as your body shape changes, sometimes certain positions will be more comfortable than others. But there actually is, apart from if there are women whose cervix is shortening, who might be at risk for preterm labor, we're asking them to not put anything into their vaginas.
And that's something their doctor would
Would have
them.
told them. But for the average person, you can have intercourse as long as you feel comfortable.
Wow.
Yeah.
Wow, thank you.
Wow.
Who knew?
We're past that, but
Yeah.
wow.
But this is for you out there, moms
Yeah.
and dads.
So,
partners.
Dr. Tina,
Yes.
can we talk babies?
Sure.
So, how about a rapid round of mom stressors?
Okay.
Okay. So, how to treat at home and when to go to the doctor. Earaches.
Always fun. Yeah. So earaches are usually what you're going to experience often with these little kids in the middle of the night, because during the day they can be distracted from that ear pain. But in the middle of the night, they are just wailing because it hurts.
Yeah.
Most ear infections, I have to say, are caused by viral infections of the upper respiratory tract. So not every ear infection needs an antibiotic. And I think as family physicians, we're being faulted for really over-prescribing antibiotics. So if your child is actually coping quite well with the earache, and on exam the physician feels that it's not going to perforate, that the distress level of the child is not
It's manageable.
easily managed at home with just Tylenol and Advil. We might not prescribe that antibiotic if we don't think that there's a bacterial component or that there is risk of perforation.
Okay.
So would it also help having them sleep kind of in their car seats, kind of upright a bit, so they're not flat on their back, and their ears are getting full? Would that help if they were a little bit more elevated? Is that even a thing?
I don't think so.
Yeah,
I think
okay.
it's often that nasal congestion that comes with the infection.
Yeah. Okay.
And what that causes is eustachian tube dysfunction. So they're the tubes that drain and ventilate the middle ear collapse, and that creates that buildup.
Oh,
Cute little kids.
poor little things.
Sore
Yeah.
Sore throats. You can cough.
Yeah.
So sorry.
That's okay.
This is cold and flu season. It's
Yeah, you're allowed to cough.
Yep. This is what it's all about.
We
This
allow
is
breathing and coughing.
yes,
here.
that's why. And if you're not ready to talk,
no
we'll
Diet
keep
Cokes,
talking.
though.
No Diet
Cokes.
Cokes. We don't bring any
Matthew's
drinks into
saying
here.
no Diet Cokes.
No.
Okay.
You okay?
Yeah, I'm fine.
Okay.
But yeah.
So sore throats. Sore throats.
So not every sore throat is going to be a strep throat. I'm having a sore throat right now.
yeah. That's not funny. We're not
She's
laughing.
method acting for us.
Right, yeah.
You know?
She's doing the experience, so we know
gosh.
what she's talking
So
about.
again,
What a friend.
I think the biggest thing about sore throats is the child can definitely run into problems if they're not keeping up with their fluids and becoming dehydrated.
Okay.
So that's
sure.
the biggest thing that you want to check on is my child having such a painful throat that their diapers are going dry, that they're not going to the washroom as often, they're running a high fever, they're quite distressed with
So
this.
dehydration could cause all that?
The dehydration can cause the lack of urination as a sign.
As a result of not
Of
being
not
able to
being able to,
drink and
yeah,
Okay.
exactly.
Oh, I
so
see what you
so there
mean.
are kids who have mono and kids who have other like strep throat
Yeah.
infections.
Yeah.
That the pain is really quite distressing, and you'll see a child that will require IV
So
support.
when should they come in and see a doctor?
So I think if you're concerned that your child has strep throat, for one thing that is important is typically strep throat will just be a throat infection, and you should not see issues with cough or other respiratory symptoms. Typically, it'll just be really painful swallowing and potentially fevers, chills, painful lymph nodes in their neck region.
Okay.
So if you think the child has strep, then I think getting that child assessed is important.
Okay.
and popsicles and things like that, maybe that would be
Would help soothe that pain.
yeah.
And then Tylenol and Advil you can give at the same time.
So when we have sore throats, we gargle with salt water, and that always helps me. But that, like, if you have a child, though, they're going to swallow it, right?
Yeah.
That's right. So it's hard to get kids under 5 to gargle. But again, you've got your lozenges that they sell at the pharmacy that have a bit of anesthetic,
Okay.
like the Cepacals, et cetera. And,
Okay.
and that's very soothing for some kids as well to just suck on those
and a
lozenges.
spray too. I've seen
There
them
is that
sprays.
spray as well.
So is there like an age on there? Like
They
for
usually
those-
have ages
Yeah,
listed.
they'll have an age on there. So check that out. And
that's good.
so fever,
Oh, I guess what temperature?
yeah, like what temperature do you bring? Bench?
They're scary.
I know.
So I think what's frightening for parents is that some kids will develop a febrile seizure. So if we get warm enough, usually under age 5, we can trigger a seizure event in our brain because of the overheating.
So is there a typical temperature for that?
It varies child to child.
Okay.
What's interesting is with most viral infections, we tend to get higher temperatures than with bacterial infections.
Okay.
So often that 104 degree temperature, if I'm going to do Fahrenheit, or over 40 degrees Celsius, those kids...
Sorry, I'm an imperial girl.
Okay.
Me too.
So those kids, we really want to cool them off.
Yeah.
And that's where using Tylenol and Advil at the appropriate dosing based on their weight might help reduce the risk of that febrile seizure by cooling them down. You've seen in the past probably people recommending putting them in a tepid bath, so not a cool bath, but just sort of warm-based water, trying to have them see if they can cool off.
Mm-hmm.
Fever actually plays a role evolutionarily to help us fight infection. A lot of people feel that fever is a good thing as far as our body trying to mount an immune response. But it's just the high-risk situation in those kids under 5, especially if you have a family history of febrile seizure, then your kids might have inherited that same preponderance to doing seizure activity if they get too warm. So it's important just to cool them down.
We took him to the hospital that sent him to another hospital, and he was just limp. Like my husband was carrying him, and he not acting. He was awake, but he was just limp. And 3 hours later, we get him home, and he was on top of one of those Rubbermaid totes surfing. So they can go from, oh my God, this is devastating, to turning around. But please take it seriously, and we're offering some helpful hints. But Dr. Tina has also told us that every child is different. So if you're concerned, you need to, seek medical attention.
And one little other proviso with respect to fever is infants that are 3 months or less of age, if they develop a fever, that's usually a sign of a pretty serious infection. If we don't know that there's been sick contacts at home or other explanations for what's going on, it's always safe to bring those infants into the emerge department to be assessed. If you can't get seen by your regular nurse practitioner or family doctor, because that's something that you shouldn't put off. So definitely 3 months or less, fever, it requires a workup to rule out a serious infection.
Wow. Well, thank you very much, Dr. Tina.
Thank you for having me.
Thank you. Oh, God. I hope you come back again sometime.
Anytime, guys. It's fun.
Yeah.
Yeah. Thank you so much, Dr. Tina. You've helped so much, and we really, really appreciate your taking time to help with these questions. This has been so beneficial.
Oh, my gosh. The time just flew by.
Oh, yeah. And I've got so many more questions. I'm not finished here. So our action item, everybody, is please try to better educate yourself on common children ailments as to when to treat them at home and when it's necessary to take them to the doctor. This can help lower your stress level so much.
Huge.
We still suggest, though, to follow your gut, and if you feel you need to take your child to the doctor, then please do it. Just go.
Yes. And thank you all for tuning in. We hope you feel heard,
Both
supported, empowered. We know you're doing your best. Please send in your questions for Ask Moms, or if you have any ideas for future topics, please connect with us by emailing askmomstoday@gmail.com.
And remember, you're not alone. So until next time, take care of yourself.
You've got this.